Focused ultrasound is a disruptive technology that allows me to deliver a treatment that my patients seek, that makes an impact in their quality of life. And it's a technology that has allowed me to interrogate brain function in ways that we couldn't do before.
Welcome to Curing with Sound. I'm your host, Dave Hendrick. Today's guest is Dr. Vibhor Krishna, Associate Professor and Vice Chair of Inpatient Operations in the Department of Neurosurgery at the University of North Carolina. Dr. Krishna is a board-certified functional neurosurgeon and NIH-funded surgeon scientist specializing in the treatment of movement disorders, chronic pain, and epilepsy. He leads UNC's focused ultrasound program and has published groundbreaking research in leading medical journals. In addition to advancing innovative, less invasive treatments, he is passionate about mentoring the next generation and helping shape the future of functional neurosurgery. Dr. Krishna, welcome to the Curing with Sound podcast. My first question for you is simply, do you remember your first interaction with the concept? Literally the first time somebody said, "Are you familiar with focused ultrasound?" or the first time you discovered it?
To be honest with you, if I think back, actually, the first time I heard about focused ultrasound was back in 2008 or 2009. We had a faculty applicant who had done their residency training at University of Virginia, and they had come in to present their work. And as a part of their research experience, they talked about the use of focused ultrasound to measure blood flow in the brain in an animal model. And they had a very nice video that showed the concept of focused ultrasound from multiple elements in a transducer that would allow you to then do brain imaging, yet also using microbubbles could help you open the blood-brain barrier and also, with a different set of parameters, modulate brain function. And so that concept for the first time caught my attention, was very novel, very exciting.
And then you decide to base your career around the technology and you've become a real pioneer in the space. How does that happen? Because it's one thing to hear about a interesting new novel technology and another to say, this is the path I'm going down.
Yeah, so I would say that the initial interest in focused ultrasound was matched by what this technology has to offer. As a field, we have challenges where we want to have incision-less treatments, less invasive treatments. We want to have the ability to deliver therapeutics in any area of the brain with a high precision and be able to do that efficiently. And certainly be able to modulate brain function in brain areas that are inaccessible today. And focused ultrasound does offer a lot of these solutions. But I have to say that my personal journey, I owe this to the inspiration that I got while working with pioneers in the field like Dr. Andres Lozano, Dr. Kulorvo Heinonen, who understood the promise of this technology and were actively working on implementing this, finding this, and testing it for new applications. And then finally, I have to say that for a clinician, a lot of the inspiration comes from patients. When you see in your clinics patients who come in and are seeking this treatment because they have done their research and this treatment makes the most sense to them, that's the most inspiring experience for me.
Can you share a patient story that really shaped the way you think about focused ultrasound and its role in patient care?
So one of the most profound experiences I had was a patient who came in to see us seeking focused ultrasound treatment for her tremors. And we did the assessment for the patient, and clearly she had essential tremor, which was disabling. And the patient came to our attention because, in her retired time, one of the main sources for joy for her was to cook meals for her family. And it would be a family get together where she would uh, uh, create what she described as the world famous recipes that she had. And, that was a way for the family to connect. And um, unfortunately, last Thanksgiving, before she saw us, she was cooking a meal for the family. And because of her tremors, had an accident that caused a fire in her home. And fortunately, she was unhurt, but her house burned down.
Oh my gosh.
Based on that series of events, her family was considering that um, uh, you know, she should think about, transitioning to a nursing home. This patient was a fiercely independent person. She had lived all her life that way, and she was tearful and didn't want to have a scenario where she would not be living independently in her own home. I was kind of curious a little bit, and I asked her, you have had this tremor for a while, and it's been 30, 40 years, and clearly for the last, several years, it's been significantly worse. Why wouldn't you consider deep brain stimulation surgery for this earlier? It's a standard of care treatment, very well-known treatment for essential tremors. And the patient surprisingly told me that she had undergone an assessment for deep brain stimulation surgery. She was found eligible for it, but did not want to undergo deep brain stimulation surgery because she did not want to have a invasive brain operation with implanted hardware to treat her tremors. And that moment was pivotal in my mind because it impressed upon me the very fact that in wake of significant challenges and disability, patients still want to pursue treatments that make them, that speaks to them, that they're able to then undergo, they want to undergo. And that's where focused ultrasound technology is so powerful. It's is that it addresses a big gap in our current treatment approach, where patients want to pursue treatments that are less invasive, that does not involve, making incisions or implanting hardware in the body.
Thank you for sharing that. How do you put into words that feeling of seeing the patient come out of the treatment and see that tremor, for instance, just stilled?
This feeling of excitement, it's a transformational treatment, and it doesn't get old. Even if you have done 100, 200 of these treatments, it's a very powerful experience where this technology can precisely deliver ablation to brain areas that are not working properly and causing patients tremor, for example, in the case of essential tremor, or brain areas that are involved with seizures, for example, in the case for epilepsy. And so this treatment allows you to very precisely ablate those uh, brain regions in a targeted way and improve patient symptoms. And that's a uh, satisfying feeling. This technology is transformational, and uh, it's exciting to be a part of it.
Correct me if I'm wrong, but you help lead some of the initial clinical trials for focused ultrasound for movement disorders like tremor and Parkinson's. How you would describe the state of focused ultrasound for tremors and Parkinson's as we sit here in 2026?
In the framework of movement disorders, I've been grateful to be involved with a lot of these initial clinical trials. And as we sit today in 2026, and I think back, this technology has opened up access to lots of patients who have disabling essential tremor, where medicines are not an option anymore, and the restrictions in quality of life that patients are facing are tremendous.
Absolutely.
This technology has also brought together our community to then work together to study the nuances and optimize this technology. This focused ultrasound has also challenged the conventional paradigms. So, if we were to think about 20, 30 years ago, uh, ablating brain areas involved in tremor and Parkinson's disease to treat symptoms on both sides of the body was considered a no-no, where risk of side effects was very high. And focused ultrasound today, using this technology, we can safely do the ablations to treat patients' tremors on both sides of the body in a staged fashion. So it has changed the conventional thinking that you couldn't do these things without creating significant side effects. It has given us insights into novel brain targets that we didn't consider before that could also improve patients, say, Parkinson's disease. And so we have a new target called the palliothalamic tract that ablating that target would improve patients' Parkinson's disease. And so, in a variety of ways, this technology has been disruptive. And the speed with which the innovation is happening in this technology is also something that's really fantastic. If you think about it, this technology has been around for a little over 10 years. We already have the next generation focused ultrasound ablation system called the NeuroPrime. We have, centers that investigated the techniques for optimizing the treatment, and so a lot of good work has come out since the introduction of focused ultrasound for movement disorders and tremors.
Absolutely. A ton of innovation in what feels like a short period of time. Let me ask you about something you just mentioned, which is the PTT treatment. So, big news in our world in July 2025, the FDA approves the use of focused ultrasound for stage bilateral PTT treatment. Uh, Can you tell us about the importance of that brain target and what that means for Parkinson's patients?
So, palliothalamic tract as a target for ablation was tested in Europe. Dr. Daniel Jaminel and his group had previously tested and reported their success with this target. And more recently, Inside Tech sponsored a clinical trial in North America to test again the safety and effectiveness of ablating PTT 6 months apart to treat patients' symptoms on both sides of the body. And this treatment opens up an avenue for patients with Parkinson's disease who have symptoms that we call them are fluctuating. When you take medicine, the symptoms improve, but as the effect of medicine wanes off, the symptoms come back. And so then patients take medicine again, and the symptoms improve transiently, and then the medicine effect wanes off. And so it's kind of a roller coaster for the patients the day. And these symptoms can include, you know, stiffness, tremors. And so this treatment is able to address all the symptoms that we talked about with slowness, stiffness, and tremor, and then be able to do that on both sides. Because most of the Parkinson's patients have symptoms on both sides. And when done successfully and when done well, you could also reduce the amount of medicine the patient is taking. And so it can make a profound impact on patients' quality of life. This treatment is now being deployed on a larger scale across the country. And we have found that the results continue to be very satisfying. Patients continue to have improvement in their symptoms. And so overall, this treatment has been transformational.
Excellent. And still relatively unknown as a treatment, I think. And so I think it's all of our hope that this will become more mainstream as more people learn about its effectiveness.
Yes.
Excellent. I know you have a keen interest in epilepsy. You've done a lot of work in the epilepsy space. Can you describe the state of focused ultrasound for epilepsy right now and maybe what you're particularly interested in?
Yeah, certainly treatment resistant epilepsy, major health problem in the United States and across the world. We have made significant strides in the treatment. Newer medications are coming on board. Yet, the number of patients who don't respond to medications still is a substantial number. Focused ultrasound, again, uh, positions itself as a incisionless treatment where the potential of ultrasound to deliver treatment therapies, to modulate brain function, and to be able to ablate brain tissue involved in epilepsy makes it a perfect match for the disorder and the technology, what it has to offer. And several groups across the country have tested how you can use focused ultrasound to open blood brain and deliver therapeutics. And this work is mainly in the preclinical stage where this is being tested in animal models. Then you look at its application with neuromodulation, where ultrasound can modulate brain function and reduce the risk of seizures. And this work is actually being tested in clinical trials in patients with epilepsy, where Dr. Alan Bubrick in Brigham's and other groups are testing the use of focused ultrasound neuromodulation in patients with medication refractory epilepsy. Then another application of ultrasound is to ablate brain areas that are involved with epilepsy. Uh, for example, you could ablate directly where the epilepsy may be coming from, or you could also interrupt the highway through which the seizures travel. And so then you reduce the risk of having what we call as generalized seizures, which were earlier known as grand mal seizures, where patients lost consciousness. And so you could interrupt the brain connections, seizures travel and impact all distant areas of the brain so that you can reduce that risk. We are particularly interested in this second type of approach, where we use ultrasound to ablate a brain area called anterior thalamic nucleus. What we understand is this area sits at the intersection of a lot of highways that join brain regions where the epilepsy starts and rest of the brain. And so we interrupt this transmission of seizure using focused ultrasound. We have tested this in a phase 1 clinical trial in 3 subjects. And this is a FDA regulated study. And so this experimental use of focused ultrasound in patients with epilepsy, we've shown that it's been safe and it has improved seizure frequency quite dramatically in patients. The first patient that we treated has used to have, several seizures a month, and now they're about 5 years out from that initial treatment and continue to have seizure freedom.
Oh my gosh.
The second patient had, again, a very high seizure burden, almost 100 seizures a month, and their seizures dramatically reduced to 4 seizures a month. And we followed that patient up to a year. The third patient that we recently enrolled in the clinical trial also used to have a very high seizure burden, and in the last 6 months have had only 1 seizure. And so this has made a tremendous impact in their seizure frequency. And so we are very encouraged by the initial results and excited to see this in larger cohort of patients. and maybe do a multi-center trial uh, so that we can bring this treatment a step closer to being a standard of care. Uh, so it's still a long way to go, but we are very excited given what we see, the initial results. And so we are cautiously optimistic for the use of focused ultrasound in epilepsy.
That's amazing. That sounds incredibly promising.
Yeah, you're absolutely right. In the selected patients in a controlled way, as we are gaining more experience with the use of ultrasound, uh, we are increasingly happy to note that it continues to be safe and it continues to make a difference in the seizure frequency in the patients that we have enrolled in the clinical trial.
Excellent. You spoke about the incredible mentors you had who helped you come up in this space. You're now in a position where you're a mentor, you're a leader in this field. What does the next generation of surgeons look like as it pertains to focused ultrasound?
Yeah, so we are in an academic medical center, and so we have residents who are pursuing neurosurgery residency and are very interested in learning more about focused ultrasound treatment. And it's a great sense of joy and satisfaction to me to be able to mentor those residents. One of my mentees, Dr. Nicole Silva, recently she's interested in focused ultrasound and is interested in pursuing a fellowship in stereotactic and functional neurosurgery. And recently, she successfully completed a project that was funded by the Focused Ultrasound Foundation, looking at sex differences in access to focused treatment. We are noticing that even though the prevalence of essential tremor is similar in men and women, uh, consistently across several institutions, we have seen that in the numbers where we treat patients, women tend to be underrepresented. And we wanted to understand what are some of the barriers that women are facing. And Dr. Silva did a fantastic job at discovering that there are delays in diagnosing essential tremor, starting medication for essential tremor in women more so than men. And then there are aspects of the treatment that women find challenging, especially the head sheave part that do with focused ultrasound that prevents them from readily accepting this treatment. And so we are organizing a engagement event in July, do a deeper dive and understand what are some of the challenges, women-centric challenges that we need to understand and address so that we have a wider adoption of this treatment in women. I have students who are pursuing biomedical engineering and doing PhD in that. UNC has a program called Unmuted, and several of the students from that Unmuted program have attended focused ultrasound treatment. They hear about this, they learn about focused ultrasound in their textbooks, but when they see the treatment in person, that's a transformational experience for them. And several of these students are going to then embrace this as a future technology that they want to learn, study, and help improvise. We are also a training site where we welcome other sites who are just starting their journey with focused ultrasound to help them understand the nuances of the technique. And so that's again a very satisfying part where all the teaching and training that I have received from my mentors and learned over the years, we are able to then share that broadly with our trainees and other sites and centers who are starting focused ultrasound.
Excellent. So it sounds like we're in good hands with the next generation.
Absolutely. We have an exciting new generation of surgeons who are embracing this technology, and I'm very confident that they will push the frontiers forward and really utilize the full potential of focused ultrasound for neurological ailments, not just restricted to ablation, but also blood-brain barrier opening to deliver therapeutics and modulating brain function with focused ultrasound.
Absolutely. Wonderful. You know that we always say that everything we do is for the benefit of the patient. And I know that you adhere to that mindset as well.
Absolutely. The patient care is front and central to our efforts, whether it be our clinical efforts, whether it be our research efforts, teaching and mentorship efforts. It's that spirit, that inspiration from our patients, the joy, the sense of happiness we get when patients get better, that drives us to then provide excellent care which matches the current standards of care in the field, excel at it, and deliver a treatment that makes a impact in patients' quality of life while minimizing their side effects. And then again, in the research realm, I see myself as a patient advocate. I wear that hat to think about what will this research deliver to make my patients' lives better. How will it make the treatment safer? Certainly, I agree with you that the inspiration for all of this comes from our patients and the desire to make an impact in their lives.
Dr. Krishna, it's been a pleasure speaking with you. Thank you so much for joining us on Curing with Sound.
And thank you for Focused Ultrasound Foundation for creating a platform so that the broader focused ultrasound community can connect and get to know each other.
This episode of Curing with Sound has been presented by the Focused Ultrasound Foundation. If you'd like to learn more about Focused Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter, News Digest, and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information on Focused Ultrasound. We would also be grateful if you would rate and review the show.